Hello there. Welcome to my show, COVID-19 update by Heerak. Today is December 27, 2020. Yeah, year 2020 is passing away and 2021 is coming. you know? Um, yeah, today is National Visit a Zoo Day. Unfortunately, zoos are closed in many places because of COVID 19. Um, that's the case in Washington, D.C. area, from what I understand. A lot of places are closed now in the United States because of COVID 19, and more will be closed in coming days, coming weeks. Um, Something like 3,000 or more people are dying every day. Obviously, right now it's Christmas season. We had Christmas and this is the weekend. So, people are not really reporting like they should because they're in the holiday mood. Yeah, Christmas, it's a very special holiday. And I'm sure many of you had a nice Christmas day. And now we're looking toward New Year's. So New Year's Eve parties are everywhere in America. Many of them are illegal, because they'll have like a lot of people. But it's like a rave. There are going to be secret venues for New Year's Eve parties, kind of like during the Prohibition. You have a lot of people who frequented these areas to drink alcohol during the Prohibition. So it's going to be far worse on New Year's Eve in the United States of America because people want to celebrate and party. I mean, people like to party and celebrate generally, but it's New Year's Eve. So a lot of people are going to celebrate and party on New Year's Eve in America, in all 50 states, like in every city. And there's going to be a lot of underground parties where, people party and they may charge $100,000, at the door or whatever. Um, but we live in America where people don't really have many places to spend the money. And it is New Year's Eve, so a lot of people are going to be willing to pay hundreds of dollars to get into a New Year's Eve party. And so you have a lot of entrepreneurs in all 50 states who want to make thousands of dollars at night, tens of thousands, maybe even hundreds of thousands of dollars. Some may even make over 1 million in these underground parties. Um, because word of mouth is always very fast. Um, you could easily have 1,000 people partying, 2,000 people partying in a big warehouse, like abandoned warehouse somewhere, in the boondocks or underground or out of the way. Um, it's not like there's a lot of traffic. You know what I'm saying? Always find places to park. Could always Uber over there. So you're gonna have a lot of like New Year's Day parties. Like in New York City, there are a lot of formal parties with a lot of people. You know, um, and some of these parties will have hundreds of people, thousands of people. So New Year's Eve is several days away, but a lot of people are planning for New Year's Eve. There's a buzz. People talking among themselves. What are you gonna do on New Year's Eve? And people organizing stuff, and entrepreneurs are already they've already organized parties, or some of them will organize today, tomorrow, day after tomorrow. It doesn't take that long to organize a party. You could organize a party like in a couple hours, really. If you have like a empty building, what you need to do is get a DJ, right? And get it like a disco ball or whatever, but it's not that hard, and then you have somebody at the door, get some bouncers, some of your buddies in the football team, and then you charge $100 for entrance fee or whatever, and then you charge like $10 for a bottle of beer or something, or can of beer, or I mean you could inflate the prices in New Year's Eve. So yeah, some people will be making like 1 million that night, in cities. So wherever there's money to be made, you're gonna have entrepreneurs entrepreneurs to make the money. So you're going to have like illegal parties everywhere in America, and police officers will look the other way because it's New Year's Eve. You know how it is. Um, so so that's coming. Obviously, people who are going to party know that they could get COVID. I mean, everybody knows COVID is around, but a lot of people are like, hey, I'm willing to risk it for fun. Some women are, wanting to find love. Guys are trying to get laid. Obviously, you should only have sex in the context of your marriage, but it's Christmas. Christmas is just past, and then New Year's is coming. So there'll be a lot of guys throughout America, millions, who are trying to get laid on New Year's Eve, which will be kind of easy given COVID-19. Probably the easiest time to get laid for all the guys. It's probably like 80 to 100% chance of getting laid. You know what I mean? If you go to one of these parties. So yeah, you're gonna have a lot of guys going to these parties, illegal parties, because guys will risk anything to get laid. You know what I mean? A lot of guys. I mean, it's bad, but it's human nature for guys. So yeah, you're gonna have millions and millions and millions of people partying all over America. I'm sure in Arlington, you're gonna have like illegal parties in Arlington County. You're gonna be illegal parties in Alexandria, city of Alexandria. You're gonna be illegal parties in Fairfax County. You're gonna have illegal parties in Falls Church. And illegal parties are anything that breaks the law. So if you have more than the number of gathering allowed, obviously it's illegal. So even if you have like 30 people partying in your big house, that's illegal, right? From different households. So in some houses you're going to have people like 30 people partying for New Year's Eve. And these are like quote respectable people. So some not all parties will be hundreds or thousands. You're going to have houses that have like New Year's parties, which will break the law by the fact that they have over the number of people allowed by Virginia state law. So that's going to happen all over Falls Church, all over Fairfax County, all over Arlington County, all over Alexandria. So that's something that you're going to expect over New Year's. And over New Year's, everybody will have like devil may care attitude. What are you gonna do? Enforce the law? Uh, you know, when there are thousands of people breaking the law on New Year's Eve in Virginia's 8th District, it's tough. It's rough for the police officers because when you have thousands breaking the law in one night, I mean, there's no way you can enforce the law. You see what I'm saying? If you have like one person breaking the law, you could enforce the law. But if you have thousands of people breaking the law, you cannot enforce the law. By definition. And there'll be police officers breaking the law in Arlington County, Alexandria, Falls Church, and Fairfax County. Politicians breaking the law. It's going to happen all over Virginia's 8th District. So yeah. Obviously, we expect COVID-19 death to hit over 10,000 per day in January. Right now, it's like over 3,000. But after New Year's parties, there are people gather for Christmas. You know, you should expect 10,000 people to die every day in January. I think most healthcare experts would not be surprised when they turn on the TV and they see like 10,000 people dead every day in January. Uh, you know, um, but people are who they are. If you have children and you tell them not to party, do they not party? If you tell your children to go keep curfew, do they keep the curfew? People are people. And generally, nobody tells adults what to do. But right now in COVID-19 America, adults are told what to do. So you think all the adults in America will listen to you if you're like a police officer or your governor or House of Representative member or senator telling you not to party? You're going to tell a bunch of adults, treat them like children, and they're going to listen to you. Yeah, good luck with that. Most likely you're going to have a lot of people partying. Uh, Yeah. Guys will be guys. They want to be around women. If they're single, they want to find some woman to get laid. Guys are always trying to get laid. That's like a guy, what guys are made of. If guys are married, they may want to, spend special time with their wife, and their wife may want to go somewhere to have fun for New Year's Eve. And, most guys will do what their wife tells them to do. So you're gonna have young couples obviously having fun on New Year's Eve in a party setting, and even couples that are older. Not everybody believes that COVID-19 is that dangerous, because right now, less than 10% of America has gotten COVID. So 90% of Americans have not been infected with COVID at all since the very beginning. So there are a lot of people who don't believe that it's that dangerous. So they're going to party. They're not going to care what you say. Um, Obviously, as a healthcare expert, I recommend you stay home, isolate yourself if you want to survive COVID. But as a human being, as a social scientist, because I'm an expert of history, I understand your human need for love and belonging, for celebration, and I understand the human desire to get laid for guys. It's purely biological, right? Um, and for women, desire to be loved, find someone to marry with because your biological clock is ticking. Your time is running out. Soon you'll be, I mean, older you get, you could be barren, right? I mean, if you marry over 30, there's high chance that you could miscarriage pregnancies. It's sad. Like women get married like after 30, and then they miscarry like 4 or 5 times in a row. It's really sad because eggs don't always stick, like they should. Because eggs over 30 years old, eggs are old. Women's eggs are born with the women, they age with the women. It's not like sperm. Sperms are created new every day. But women's eggs, they were with you when you were born as a baby, and they grow old with you. So by the time you're 30, your eggs are 30 years old. They're like really old. So that's why a lot of women over 30 can have trouble getting a baby, conceiving, because their eggs are really old. And they're 30 years old. It's like old. Ask any teenager, what they think about 30-year-olds. They'll say that's old. Um, and you can get pregnant in teenage years too, right? You can start getting pregnant in puberty. So your eggs were meant biologically to get pregnant in puberty, and so biologically that's how your body is designed. And obviously, Romeo and Juliet, when they got married, they were 13 years old. Both of them were. And Gandhi and his wife were 13 years old. And if you saw the movie Breakfast at Tiffany's, she got married when she was 14. That was common in America. And when the death lifespan was short, like people died at 50, people got married when they're 13 and 14 because they knew they were going to die around 50. But biologically, you could have baby. You get married at 13, 14, have a baby. For most of human history, 99% of human history, people got married really young. It's just modern era, people are getting married older, but that's an aberration. It's abnormal. It's an abnormal thing in terms of human experience. Most of human history, people got married much younger than they do get married now. So we're living in an abnormality. We're living in the exception, not the norm. When you compare, let's say, the whole history of humankind from beginning to now, people used to get married far younger. So who's to say we're right and there were, 99% of history is wrong, right? And that's what we assume in America. But even now, in parts of world, there are people who get married far younger than 21. So who's to say they're wrong, right? Biologically, um, you know, um, if you can have a baby, then biologically you could have a baby. By definition, right? And so if you're 30 years old, you're like really old, biologically speaking, and your eggs are really old. That's why when you marry after 30, you have a hard time conceiving. Many people have a hard time conceiving, and some people just can't conceive. And it's tragic, but you should get married younger. I recommend you get married like 18 to 22. I think that's a good age to get married. Start a family, start getting children. When your eggs are young, don't wait until your eggs are like old and wrinkly to get pregnant. Um, yeah. So yeah, but America is we're in COVID-19 America. Um, you know, it was Christmas a few days ago. It's Sunday today, so the numbers are not accurate, because not everybody's sending in their numbers because it's Sunday and it's like Christmas was last few days ago. So everybody's still in Christmas holiday mood. So, the numbers that have been reported is 1,160, but it's far higher than that. It's probably over 3,000. But, I mean, who's going to report on Christmas Day or during the weekend after Christmas when you're just kind of like recovering from all the fun, right? So yeah, so at least with the reported numbers, we are at 333,069 COVID-19 deaths so far in America, and that's going to increase. As you know, I'm predicting that over 3 million Americans will die by June 2021 because all the hospitals will fill up eventually, and those who need to go to hospital will die. So if 10,000 people need to go to hospital, all 10,000 will die. If 100,000 people need to go to hospital, all 100,000 people can die in one day throughout the United States of America. So I would be surprised if we turn on TV and say, oh, 100,000 people died today. I won't be surprised at all. Because if there are no hospitals, it's possible 100,000 people who need hospitals will die. I mean, it's a logistic possibility. It's a scientific possibility. So yeah, I wouldn't be surprised if I turned on TV and said, oh, 100,000 people died today. I won't be surprised at all. And you shouldn't be surprised at all either because I told you that that could happen. I'm hoping that that won't happen, but that could happen. Santa Claus is like, hey, it's no longer Christmas. I left. you know, it's several days after Christmas. Don't be looking at me asking me for Christmas gift. Hey, COVID is king now. Yeah, right. The moose is like, yeah, I left too. You're on your own. So yeah, it's no longer Christmas. And the reality is hitting you. Some of you, that we are now in COVID-19 America, and some of you will drown yourself in alcohol because you're depressed about that. I understand that, especially because it's New Year's. You shouldn't drink alcohol like in excess. It's not good for you, But I see, a lot of you are gonna just drunk yourselves to stupor. you know, I mean, on New Year's Eve, people drink a lot, but especially in COVID-19, you're gonna drink more. A lot of people will probably die of alcohol poisoning over the New Year's, in the next few days. That's sad, but that's probably what's going to happen. Um, yeah, because New Year's reminds people what they're missing out on, right? More than any other time, because New Year's, like people used to celebrate in Times Square, like crowded, like with no space between them, like tens of thousands, hundreds of thousands, partying together in New York on New Year's Eve. None of that now. There's no human element to the kind of belongingness, and people don't feel the belonging anymore. And people have a need to feel belonging, and so a lot of human beings in America are going to go into anxiety, depression, anger, and some of them will kill themselves. Unfortunately, don't kill yourself, because if you kill yourself, you go straight to hell. If you're successful. Um, some of the people will engage in self harm. Some of the people engage in harming other people. you know, um, you're gonna see more and more of that as time passes. People trying to harm other people. So crime rates will go up, home invasions will go up. If you're a father, you should definitely get pistol, semi-automatic pistol, um, shotgun, and semi-automatic rifle, because there's going to be home invasions, especially if you live in the city, or if you live in a rural area like and isolated, you can expect home invasions. So if you don't have enough firearm and ammunition, you should get it, because you have to protect your wife and your children, right? I mean, you have an obligation. So violent crimes will go up. People who engage in self-harm will go up. People who engage in harming others will go up. And that's going to continue now. Today is December 27th. It's going to continue in December and January, February, March, April, May, June. So you're looking at 6 months of exponential growth in self-harm among Americans, exponential growth in harming others in America, in every city, every state, every county, every town. And even now, you look at Arlington County, Alexandria, Falls Church, and Fairfax County, Washington, D.C., Montgomery County, there's a lot of crimes, violent crimes being committed right now, more so than before. So we're already seeing an uptick of violent crimes in this area in Virginia's 8th District. And we have 6 more months to go. So home invasions would definitely increase as people don't have money to buy things or pay rent or buy food for their children. People who never thought about committing criminal acts will start committing criminal acts. They will become robbers. Where do you think criminals come from? Do you think people are like, I want to be a criminal, when they're a child? I'm an elementary school teacher. Not a single student I taught said, I want to be a criminal. They all want to have dreams of what they want to do at 5th grade level. And I taught several elementary school 5th graders, which is in the Anacostia neighborhood, Ward 8, which is probably an area with very high crime, if not the highest crime in Washington, D.C. Not a single student that I had said they want to be a criminal. They all have dreams to become something great, and I obviously encourage that as their teacher. And I taught at Savoy Elementary School before I started my master's in clinical nurse leader program at Georgetown University in 2018, full-time program for 2 years, graduated in 2020, August 24th, with fellow clinical nurse leaders. So there are 25 of us. So I want to do a cheer for my clinical nurse leader members, because I know some of them will die from COVID before June. It's expected. If you work in a hospital setting, you can get COVID and die. It's expected. CNL 2020, yay! We graduated from Georgetown University. Some of you will die from COVID-19, but at least you could say you graduated from Georgetown University with CNL degree, yay! There are nurses in hospital who are crying crocodile tears before every shift because they have to take care of COVID patients. Do you know that? There are nurses who actually cry, they tear up because they have to take care of COVID patients because they're so afraid they're gonna die. You haven't seen this because you're not a nurse. I'm a nurse. I work in a hospital. I work at Virginia Hospital Center. And I have seen nurses tear up and even cry because they have to take care of COVID-19 patients. No, I'm serious. These are nurses, some nurses who've been nurses for over 10 years. They cry because they have to take care of COVID-19 patients. You know that? You haven't seen this, so you don't understand. I've seen it. There are nurses who are begging for other nurses to take their patients. They're like, I have like all COVID patients, and I have 2 little kids. Can you take my patients because I don't want my kids to die from COVID if I get COVID. This is going on in every hospital. It's going on in Fairfax Hospital, Trauma One, in Trauma One Hospital. It's going on in Innova Alexandria Hospital. It's going on in Virginia Hospital Center. It's going on in MedStar Georgetown University Hospital. It's going on in MedStar Washington Hospital Center. It's going on in Children's National Hospital in Washington, D.C. It's going on in George Washington Hospital. It's going on in Suburban Hospital in Montgomery County, Maryland. It's going on in Sibley Hospital in Washington, D.C. It's going on in Mount Vernon Hospital. It's going on in Dominion Hospital. It's going on in Adventist Hospital in Shady Grove. It's going on in St. Mary's Hospital. It's going on in every hospital. Nurses are crying, literally crying, because they have to take care of COVID patients. Yeah, because hospital increased in the number of COVID patients. There are nurses who literally cry. No, they really cry because they're so afraid they're going to get COVID and die. And, nurses who have little children, they're afraid they're going to get COVID, pass it on to their children are going to die because they're nurses. They know how dangerous COVID is. They've seen COVID patients die in their arms. Well, not in their arms, but because smart nurses don't hold COVID patients like this, obviously. I mean, it's like, oh, give me COVID. That's an idiotic thing to do. But they've seen COVID patients die like right before them. So nurses know how dangerous COVID is and how much suffering you have if you have COVID and it gets bad, because they treat these patients. They see them grasping for air and they can't breathe. I can't breathe. I can't breathe. I can't breathe. I can't breathe. They see this and then they die. So nurses have seen this. So they're deathly afraid to take care of COVID patients. Those nurses who've seen COVID patients die. Yeah, I mean, some nurses are like, some of these COVID patients are my age. They're like 22 and they're like dying. You know that this is happening in Virginia's 8th District right now? Yeah, in Arlington, Alexandria Falls, Richard Fairfax County. There are 20-year-olds like grasping for their life. They could die at any moment. They could die this shift, they could die next shift. That's going on right now in Innova Fairfax Hospital. That's happening now in Innova Alexandria Hospital. The 22-year-olds are grasping for air, holding onto their life. They could die at any moment, any day. There are COVID patients, 22-year-old COVID patients, grasping for their life in all the hospitals in this area. George Washington University Hospital, Georgetown University Hospital, MedStar, Washington Hospital Center, Sibley Hospital in DC, Suburban Hospital, Adventist Hospital in Shady Grove. And the number of COVID patients are increasing. What do you think is happening? Where do you think the death numbers are coming from? There are patients dying in large numbers throughout America. Average of like 3,000 in December, late December. Obviously right now it's 1,160, but that's not accurate. It's like Christmas break, holiday weekend. So, not everybody's reporting, but I'm sure it's over 3,000. So you have in every hospital in the United States of America, nurses tearing up before their 12-hour shift because they have to treat COVID patients, because they know that this can be the day that they could get COVID and die. This is happening in every hospital right now. Do you think like nurses are robots that they don't feel? Like, do you think nurses are like, oh, I'm going to treat COVID patients. It's okay. I'm not going to get COVID. Do you think that's how nurses think? You know how many nurses have died so far treating COVID patients? Of course, nurses can get COVID and died with all their masks, all their gloves, all their gear. You think that nurses who got COVID-19 did not wear a mask, did not wear gloves, did not wear like the whole, face stuff and everything? You don't think that's of course they all wore it. They did everything right and they still got COVID and they died. This is a scary stuff. COVID-19 is scary stuff. I was talking to one of the nurses at Virginia Hospital Center. I said, COVID-19 is kind of like the flu. I just wanted to see like what she would say. She's like, no, COVID-19 is like you know, like 1,000 times worse than the flu. That's what I'm saying. I mean, a very experienced nurse who's been a nurse for like over 20 years. I just started. I graduated from Georgetown University in August 24th. I just started. Um, so, it's interesting to see the perspective of people who've seen a lot of patients die in 20 years of nursing. They've seen all kinds of things, everything there is to see. And they're like, COVID-19 is nothing like anything that we've seen. And they're genuinely afraid of it. I mean, you don't know how scary this COVID-19 is. Because you don't see it. But yeah, I mean, I have literally seen nurses cry. I mean, tears are dripping down, because they have to take care of COVID patients. Yeah, they're definitely afraid that they're going to die, that they're going to get it, give to their husband, and their husband's going to die, or both them and their husband's going to die. Because we had cases where the nurse died and nurse's husband died too, from COVID. And not just husband, like nurse's father died. We have cases where a nurse infected like many members of her family, and like 5, 6 people died just because the nurse got COVID. I mean, that can definitely happen to nurses at Virginia Hospital Center. Every nurse in Virginia Hospital Center knows this. I know this. Why do you think I didn't go home for Christmas? Because obviously I don't have COVID, but you never know. I mean, you can't be too careful, right? I'm not, I'm single. I hope to get married. I've never been married. I don't have children, so I hope to be married, but I'm single right now. But most nurses have like a husband and children, right? And many nurses have been nurses for many years. And they can get COVID and die. They can get COVID and give to their husband, and their husband can die. They can get COVID and their children can get COVID and die. Yeah, that's how it is. I've observed many conversations. Like, one nurse is like, oh, I have COVID patient, all COVID patients. Can we like, do you think you could take my patients? And nurse is like practically begging another nurse. And the other nurse is like, I can't take your patients because I live with my mom and dad. And if I get COVID, they're going to die. You know that? I mean, you don't understand what's going on in hospitals with nurses. You think like, oh, nurses come in to work and they're like, yay, we're going to treat COVID patients. Like, you think that's how nurses are? Nurses are deathly afraid every day before the beginning of the shift because they're deathly afraid they're going to get COVID and die. That's like majority of the nurses. I mean, some nurses hide it, but deep inside, I'm sure that's what they're feeling. Because we've been trained to understand how serious infections are, right? We have like infection protocols. Why do you think we have infection protocols? Because we know how dangerous infections are. And there's no infection like COVID infection, because it's an infection. Yeah, yeah, in January, I expect at least 10,000 people to die per day. We're going to hit it at some point. Yeah, I'm like positive of that. We're going to hit 10,000 deaths per day. It's just a matter of when, not like, we'll hit it. Will it be early January, mid-January, end of January? I mean, it could still be like in February, but I think it'll be in January. Yeah, I mean, that's definitely coming, winter started on December 22nd, right, or 21st. Yeah, so we're fully in winter now. And we're in the beginning of winter. Yeah, I mean, you know how many nurses are going to die in Virginia Hospital Center before this is done, before June? There will be dozens of nurses dead in Virginia Hospital Center before June. You know how many nurses are right now out with COVID-19 in Virginia Hospital Center? You'll be surprised how many nurses are currently, like today, December 27, 2020, not allowed in Virginia Hospital Center because of their COVID infection or because of COVID exposure that will lead to infection. You know how many nurses cannot go to Virginia Hospital Center where their full-time employees are, they're bar prevented from coming to the hospital because of their COVID infection, you'll be shocked. I mean, so this is not just happening in Virginia Hospital Center. This is happening in Inova Fairfax Hospital. I'm sure there are far more nurses infected or exposed to COVID and can't work. They're prevented by Inova Fairfax Hospital, Inova Trauma One Fairfax Hospital from working because of their infection. I'm sure their number is like triple our number, you know? And I'm sure Inova Alexandria Hospital has a lot of nurses who are infected with COVID or exposed to COVID and they can't work as a nurse. That's their full-time job because they're infected with COVID or exposed to COVID. I mean, this is happening in our area hospitals right now. We're just 8th district. What do you think is going on in America? What do you think is happening right now in Virginia's 8th district, Arlington, Alexandria, Falls Church, Fairfax County? MedStar Georgetown University Hospital, I'm sure they have many, many nurses who are prevented, like they're not allowed to come into the hospital because they're infected with COVID if they have mild symptoms or they're asymptomatic. And I'm sure there are nurses in MedStar Georgetown Hospital who are now in ICU struggling to live because their infection has gotten worse. Like every hospital, you know, has nurses treating fellow nurses in the ICU. You know that? In Virginia Hospital Center, I've literally heard people tell me this. They said, Inova Alexandria, Inova Fairfax, there are nurses in ICU treating other nurses, their colleagues, their co-workers, because they got COVID, they got infected with COVID while working as a nurse. They're struggling for their life. They're intubated, like tubes going everywhere, in every orifice, you know, and they're struggling for their life. You know, this is happening right now in Virginia's 8th district. What do you think? This is a joke? You think like, just because you don't see infection, like nothing's happening? Oh yeah, it's getting worse. A lot of you are gonna die. A lot of you watching this show would die of COVID-19. That's guaranteed. A lot of you watching this show in Arlington, Alexandria, Falls Church, and Fairfax Center, Fairfax County would die of COVID-19 before June. That's guaranteed, absolutely guaranteed. I don't want to make you upset, but you have to be aware of what's going on. It is no joke. When we say 3,000 Americans are dying of COVID every day, these are real numbers. These are not fake numbers. These are real people. Like nobody's creating this fiction, right? It's not like, oh, Holocaust did not happen. It's a fiction. No, it's happening now. People are actually dying of COVID in every hospital right now. This is Brazilian music. Isn't this great? Many of you are going to lose your children to COVID-19 death. Many of you are going to lose your husband to COVID-19 death. Many of you are going to lose your parents to COVID-19 death before June. It's guaranteed, absolutely guaranteed. It's a good song though. At least you have good music to listen to before you die from COVID. And you know, you gotta live every day because you don't know when you're gonna get COVID. You don't know when you're gonna die. Yeah, I mean, you know, if you're a bus driver, your chance of getting COVID and dying from it is so high. If you drive an ART bus, you know, I sometimes take ART 45 or ART 41, Arlington, you know, Transit. I mean, if you're not wearing that N95 mask, I mean, every day is a risk. Every day you wear like a flimsy mask, now you can get infected with COVID every day. Now that they're opening front doors, before they let the passengers enter from the back door, now they're making the passengers enter from front door. If you're not wearing an N95 mask, you're gonna get infected. You know, I mean, you have a very high chance of getting infected. Like if you're a bus driver for ART bus that opens the front door where passengers pass every day, I'll be surprised if like you don't get COVID. Like there's a higher chance you're gonna get COVID than not get COVID. Yeah, you should expect to get COVID, I would say. If you're a bus driver driving ART bus in Arlington County, you should expect to get COVID. Or Metro bus, you should expect to get COVID if you're not wearing an N95 mask. You should expect it. I mean, you should write a will. You should prepare for your children to become orphans. You should write out a will. Because now that they're opening the front door, all the passengers are going in through the front door, talking to you, you know, and many of them are not wearing their mask properly. So, all their particles are coming out. Yeah, you can get infected, I'll be surprised if you don't get infected. I think like more than 50% of the ART bus drivers will get infected and many of them will die. That's my prediction. If you're not wearing an N95 mask, you should form a union, or if you're part of a union, you should demand that your bus company, ART, Arlington Transit, give you N95 mask every day. You should demand that because it's about your infection. You're not going to protect yourself just with a regular mask in the enclosed space of a bus. You need an N95 mask, and you need to use your union to not only require them to give you one N95, like N90 mask, new ones every day. You should require them to teach you how to use it, so you're using it properly. What the heck is a union for if you don't use your union to save your life? As you know, I'm a union leader. I've been elected by Washington, D.C. public school teachers, because I'm a union member of Washington Teachers Union, Local 6 of American Federation of Teachers. So I was sent as a delegate to National Convention of the American Federation of Teachers. And I represent the interests of the union, right? One of the things that you have to fight for is N95 masks. If you're going to be around people, you must negotiate with your employer to give you free N95 mask every day. Because they're expensive. Like I was trying to order N95 mask for myself because I prefer to wear N95 mask everywhere because that's the safest mask. But it's like I was checking the prices out. It's like $20 for one. I mean, I don't know. I'm like, what? $20 for one? That's like one day. You wear it one day, you throw it away. $20 for one. That's like the cheapest price I've seen. So I'm like, man, but that's the safest mask. It's called an N95 respirator. So ART bus, Metro bus, you need to tell your union leaders to negotiate with your employers to give you N95 respirators every day. Like if you can't have your union members to negotiate that, what good is your union? Because you're going to die from COVID. If you don't have an N95 respirator, your chance of getting COVID is like 90%. I mean, there's 10% chance you're not going to get it. But if you don't have an N95 respirator with the buses with front door opening, your chance of getting COVID is like 90%. Every day you go to work, your chance of getting COVID is 90% with your flimsy little mask that you made at home or you bought, like one of those flimsy cloth masks. It's not, if you're a bus driver, man, you're screwed. You're literally screwed. You need an N95 respirator. If you don't have an N95 respirator and you don't want to die, don't drive the bus. You know what I mean? Because your chance of dying is very high. Yeah, every bus driver in Arlington, every bus driver driving Metro bus, your chance of dying is very high. I mean, you may not die, but your chance of getting COVID is very high. Let's just say. Yeah, and I would recommend, like, if you have a union like Walmart, I don't think the Walmart has a union, but if you have a union, you gotta tell your employers, you gotta go through the union to require your employer to give you N95 masks. I mean, that's like absolutely mandatory. I mean, your risk of getting COVID is really, really high. You could die from COVID. Yeah, what good is a union if you cannot negotiate an N95 respirator for you, like a new one every day, right? What good is your union, really? I mean, what good is your union? Yeah, so yeah, you gotta fight for what's really important in the present. And N95 mask is the most important thing for you to survive COVID. So a lot of you are going to die. A lot of you bus drivers are going to die. I mean, that's like guaranteed. You know, what do you think is going to happen? Like all these people with COVID getting into your bus, do you do temperature checks before they get into your bus? You don't know who has COVID or not. It's absolutely guaranteed that some of the people getting into your bus has COVID. It's 100% guaranteed. Like in a typical day, you're going to have at least one person with COVID getting into your bus. It's like guaranteed, whether symptomatic or asymptomatic. And you're not going to get COVID? Yeah, right. You're not Superman, are you? Are you from Krypton? You know what I'm saying? Planet Krypton. Yeah. But you know, we do have memories. I mean, if you are lying there in ICU bed dying, hopefully you have some good memories to remember. You know, so I'm sharing some happy memories here. Um, you know, you know, I went with my best buddy, middle school best buddy, Ed Mosang, and you see the picture of Ed at the church. Because you know, wherever I go, wherever we travel, we're Christians, so we go to a church, right? So this was like Ed is single, I'm single, so we're always looking for pretty women, you know, that could be, you know, that we could marry. But actually, at this time, I think Ed was engaged to Karen. I think he popped the question before this trip, but we organized this trip long before he popped the question. So we went but he was like thinking about Karen the whole time, you know. But yeah, so we went to Mexican church. It was all in Spanish, but we know some of the songs. It was Christmas time, so we sang like in English. And you see the choir there, Mexican choir. They sang, and it was a good church. You know, I enjoyed worshiping there with them and all the Mexican brothers and sisters in Christ. It was all in Spanish. Sermon was in Spanish, and neither Ed or I understand Spanish. I would have learned Spanish, but I should have learned Spanish. You know, I learned French and German, so I could understand those. But I don't understand Spanish. So, yeah, oh, well, what can you do, you know? Life is like that, right? You can't be everything. You can't learn everything. We're mortal. We're limited. Ed and I, you know, it was a New Year's Eve. You know, we went like this time, you know, like after we spent Christmas with our families, like on December 26th, we flew out to like Cancun for fun times. Fun times. So to spend the New Year's Eve, you know. Um, so you know, like we went to Senor Frogs, which is like a kind of cool hip place to go. So I have a photo there with Senor Frog. We did a lot of fun things. You know, Cancun is a fun place. You know, like we went boating. We went like you know sand dune buggy riding. We you know went to beach. You know, and snorkeling. Um, and yeah, so we had a lot of fun over New Year's, and we met some beautiful Mexican women. I think they're from California, so they're like kind of like Mexican Americans, but they're like Californians, you know. But I think they were there to visit their like mom and dad, and not mom and dad, their grandma and granddad for Christmas. And then there was this, you know, out there partying after, you know, for New Year's Eve. But yeah, because there are a lot of Mexican Americans who go home to Mexico for Christmas, and then they do a little traveling or vacationing afterwards, you know. Um, so yeah, so there is the bulldog. Top T is covered by the bulldog. So top COVID-19 cases in Latin America. Um, and yeah, so Brazil is number one at 7,484,285. I hope nobody in my unit dies from COVID. I have this sick feeling that somebody's going to die from my unit from COVID. You know how it is. You know, I mean, I guess you know you expect people to die, right? I mean, COVID America, like I expect like dozens of nurses to die in every hospital in this area because it's COVID-19, right? So dozens of nurses will die from Virginia Hospital Center. Dozens of nurses will die from Innova Fairfax Hospital. Dozens of nurses will die from Innova Alexandria Hospital. Dozens of nurses will die in MedStar Georgetown Hospital. Dozens of nurses will die in like Washington Hospital Center. Dozens of nurses will die in George Washington University Hospital. George, dozens of nurses will die in Children's National Hospital. Dozens of nurses will die in Sibley Hospital. Dozens of nurses will die in Suburban Hospital. Dozens of nurses will die in St. Mary's Hospital. So dozens of nurses will die in Adventist Hospital. You expect that, it's COVID-19 America, and this is an infection. We're talking about an infection here. Infection happens people to people. So people are going to die. Nurses are going to die. So nursing is the most dangerous job. Even with everything you're wearing, you can still get infected. Because maybe there's a hole in your mask. Maybe your mask becomes loose. When you're helping a patient, your patient may like use her hand to reach out and then knock your mask out, for example. And then you're infected. You're exposed and you can get infected. I mean, patient may not be trying to knock your mask out, but patient may be moving around delirious from the pain or from COVID. And she's like just like delirious and can knock your mask out by mistake. Anything could happen, So dozens of nurses will die in every hospital. I mean, think about it this way. We're only in December. Winter just started like December 21, December 22. Winter just started a few days ago. We have 3 months of winter to go. Hospitals are full, right, in this area. Why do you think a lot of nurses won't die? I mean, that's irrational. A lot of nurses will die. That's guaranteed. Absolutely guaranteed. 100% guaranteed. A lot of nurses will die in this area because hospitals are already full. Every nurse working now, unless they're delusional, know that they could get infected with COVID and die. Every nurse. Of course. I mean, Jesus is an infection. COVID-19 is an infection that is aggressive infection. Like any infection can kill you. Any infection can kill you. They have the potential to kill you, but COVID-19 is a very dangerous infection, far more dangerous than other infections. That's the problem, right? Yeah, and so but you do have memories. If you're gonna die from COVID, hang on to your happy place, happy memories. But yeah, but I mean, I'm sure a lot of people are going to die, but these are not just numbers; these are real people. And I'm sure it's possible for nurses in my unit to die too. I mean, I don't want any one of them to die because I love the nurses in my unit, and we really get along well, and I enjoy working with them. They're really nice people, and so we work together really well. So I don't want any one of them to die. I don't want any of the nursing assistants or patient care technicians to die, obviously either. I don't want any physical therapist or occupational therapist to die. Because physical therapist and occupational therapy, that's a pretty dangerous job because they work very close with patients. And so if the patient has COVID, it could be dangerous, because they're working very closely with patients to get their physical condition up, so they could be discharged from the hospital because they could, they have to be functional to be discharged from the hospital. Very dangerous job, physical and occupational therapy, because they work like body to body with patients, in some cases. Yeah, so yeah, because they have to teach the patients to walk and to do all kinds of stuff. So it is dangerous out there. And obviously doctors, they have to like examine patients carefully. It's a dangerous job as well. So everybody works in a hospital. I mean, they could die. I mean, obviously from COVID. But I'm just talking about the nurses right now because I'm a nurse. But it's sad because nurses are going to die. Dozens of nurses are going to die by June. You know that. And so you're always afraid like someone will get COVID. and die. You know, is that something it's a fear that I think all the nurses live with, because we generally, I generally like my coworkers, fellow nurses, and I'm sure they like their like nurses that I work with, like they care about each other too. So yeah, it's a bad situation to be in now in America, where that some nurses will die. You know that a nurse in your unit's going to die. It's kind of like a war, I guess. If you join the U.S. Marine Corps and you have a unit and you're shipping out to Iraq, you know that somebody could die from an improvised explosive device. You know, um, you just don't know who, but someone will die. At some point. So you're in a state of alert because you don't want to die, so you're trying to be careful. But despite all the caution, improvised the explosive device explodes and somebody dies. You know, despite all the care and caution we take as nurses not to get infected from COVID, some of us will get infected with COVID and die. And that's something that I think all the nurses at Virginia Hospital Center understand. Um, and not just Virginia Hospital Center, Fairfax Hospital, Alexandria Hospital, understand nurses in MedStar, Georgetown University Hospital understand that they could get COVID anytime and die. Nurses at Virginia Hospital, MedStar, Washington Hospital Center know they could get COVID anytime and die. Nurses at Children's National Hospital know that they could get COVID anytime and die. Nurses at George Washington University Hospital know that they could get COVID anytime and die. Yeah, I mean, these are like knowledge that you have. And it's like any soldier, right? In a war. If you're a soldier going out to war, you know they could die fighting in a war. I mean, in peaceful time, being a soldier is very safe. Right now in COVID-19 America, being a soldier is far safer than being a nurse. Yeah, a lot of nurses are going to die. So yeah, so it's going to be bad, but I think nurses understand where we are and what we're facing, right? Um, and it's something that we are aware of every day. Um, and so, yeah, this infection is very real. COVID-19 infection is very real and very lethal. Uh, so you got to treat it seriously, obviously. Um, yeah, so Brazil has 7,484,285 cases. Death is at 191,139, 3% of dies. I guarantee you, a lot of nurses died there. That includes a lot of nurses, a lot of doctors. Colombia is number 2 at 1,594,497 people got infected, and a 3% death rate. You see the death rates are going up from 2% to 3%. Yeah, it's happening already. It's going to go up above 10% every country over winter. So 42,171 people have died. I guarantee you in Colombia, a lot of Colombian nurses have died. A lot of the 42,171 are nurses. They died. That's a guarantee. Argentina, you have 1,583,297 infections, dying at 3%. These percentage of death are going up. In winter, it's going to go above 10%. Every state, it's going to go above 10% in America. You'll see. So if you get infected, you can die. Just remember, especially in winter. So 42,650 people have died in Argentina. And I guarantee it, many of them are nurses. Mexico, 1,377,217 people have got infected. They're dying at 10%, near 10%, 9%. 122,026 people have died. Many of them are nurses. A lot of nurses die. Because they're taking care of COVID patients, so they have high chance of getting infected. Peru is 1,005,546 got infected. 37,368 people have died. 4% death rate. Yeah, a lot of them are nurses. A lot of nurses in Peru have died. So nurses are dying, not just in America, not just in Virginia and DC and Maryland. Nurses are dying in every state in America, every city in America. Nurses are dying in every country in the world. Yeah, it's the most dangerous job to be a nurse. So if you want to become a nurse, make sure you know that you're headed toward death. I mean, you may not die, but you can die. So don't go to nursing school unless you're ready to die. Because as you know, COVID-19 is most likely forever. It's a 365 days a year virus. It's never going to go away. It's aggressively mutating, so all the vaccines you're taking now will not work. Yeah, because there are like thousands of strains of COVID. Vaccines are going to block all the thousands of strains out. Even if it works against one strain, you get infected with other strains. It's useless. I mean, if it works against one or two strains, it's useful for those two strains, but there are thousands of strains. So yeah. Yeah, so I mean, you get vaccinated, you're not safe from COVID. You're very vulnerable. The title hasn't been changed from yesterday. Japan faces COVID, tragic death. For those of you who've seen the show, for some reason there's a typo there, but actually it's about Massachusetts, Connecticut, and New Hampshire. So New England. So Japan should be New England faces COVID-19 tragic death. There's a typo, so Japan hasn't been changed to New England. But it's happening everywhere, not just Japan, not just England. It's happening in America. It's global. That's why we call it global pandemic, right? Herodal is like global. I understand global. It's happening everywhere. Some places more than others, like America's #1 for COVID-19 death. First article, New Hampshire ranks #1 in COVID-19 nursing home deaths. So New Hampshire has the title for #1 in COVID-19 nursing home death. Isn't that sad? Mark Hayward, the New Hampshire union leader, wrote this article. A lot of elderly are dying. A lot of elderly are dying. That's really sad. One statistic from the COVID-19 pandemic makes New Hampshire stand out from all other states. The percentage of COVID-19 death in nursing homes and long-term care facilities, 80% of New Hampshire's COVID-19 death, 80% of everyone who dies in New Hampshire from COVID-19, 4 out of every 5 have involved residents of long-term care facility, or what we call skilled nursing facility. Is that sad? 80% who go to skilled nursing facility die in New Hampshire. And that's really sad. That's really, really sad. A lot of elderly go to skilled nursing facility to recuperate. If they have a condition, or if their family members cannot take care of them at home. It's really sad. It's like they're going to their death. It's really sad. In New Hampshire, 80% of the deaths are in these rehabilitation centers. It's really sad. It's really sad. They gotta get better PPE. In skilled nursing facilities, yeah, they gotta do a better job controlling the infection. They're probably not doing a very good job controlling infection right now in New Hampshire. So it's a problem. Because it's an infection, right? If your patient gets infected, they have high chance of dying if they're old. So you got to try to prevent the infection, right? But they're not doing good enough job of preventing the infection, it seems. So 4 of every 5 have involved residents of long-term care facilities, according to state and federal data. That percentage is twice the national average. Twice the national average. It's difficult to explain the high rate, say Brendan Williams, president and CEO of New Hampshire Healthcare Association, a trade organization that represents states' nursing homes. The U.S. Centers for Medicare and Medicaid Service consistently ranks New Hampshire nursing homes among the best in the country. Isn't that ironic? Their nursing homes are ranked the best in the country, but so many are dying in these nursing homes. That's the scary thing about COVID. Doesn't matter if you're the best hospital, best nursing home. It's not going to guarantee that you live. That's the sad thing. That's a tragedy. So you go to the best hospital in America and die from COVID. And that's happening right now everywhere. Second article, dozens of Connecticut doctors ask Governor Lamont to close gyms and indoor dining as COVID-19 hospitalizations continue to spike. Because once hospitals are full, 100% of the people needing hospital will die, can die. 100% can die. That's why I'm saying you should not be surprised if you turn on TV and they say 100,000 Americans have died from COVID today in the last 24 hours. If the hospitals are full, 100% of the people who need hospital will die, can die. So yes, 100,000 Americans can die in one day. And that's definitely scientifically possible. Why do you think these doctors are asking the government to close gyms and indoor dining? Because they don't want any more infections, because more infections equals death, more death. More infections, more death. More infections, more death. More infections, more death. More infections, more death. They go hand in hand. I think Virginia's governor, Ralph Northam, should close down all indoor dining in Virginia. He hasn't done it yet. And our infections are climbing because of it, right? Because we don't have our restaurant indoor dining closed yet. Yeah, you have to take concern. Virginia had the highest infection, 3,999 infections today, Sunday, 24 hours. So why do you think this is happening? Because Virginia Governor Northam is not shutting down indoor dining in all the restaurants. We have to shut these things down. Yeah, if you're a restaurant owner, either make sure you do a good job with delivery or sell your business and start something that's more COVID-19 friendly, you know? What are we gonna do? Keep paying PPP to like business owners for the next 10 years? That's absolutely ridiculous. PPP is not gonna save America. Because we need to close the restaurants down to save people's lives. Business is not more important than human life, right? So PPP is not the way to save America. You gotta let the business that's gonna bankrupt go bankrupt. What are you gonna do? Stimulus checks is the way to go because you have 330 million Americans. They all need help. COVID-19 America. Stimulus checks is the way to go. PPP is not. PPP does nothing because PPP buys time. For those of you who don't know PPP, PPP is like funding for businesses to keep the business open and pay their employees. Keeping the business open is what's killing people. You gotta close the businesses down. So if you're paying everybody stimulus checks, then you can close the businesses down, and then we as a nation can survive COVID and flatten the curve. PPP is the problem because you're paying business owners money to keep their businesses open when they could close for COVID-19. PPP is the problem, right? Because you give businesses PPP to keep their businesses open They're not going to close their business. Infection is going to spread like wildfire among their employees. Close the businesses down and then pay each employee a stimulus check. And what are you going to do? Force everybody to work in COVID-19 America if they don't want to? We have to flatten the curve. This is going to be a permanent condition for America. It's never going to go away. We're going to have thousands of deaths every day, next 365 days, or 365 days of 2021. PPP is the problem. I say shut that program down. You know, you're trying to pay off business owners to keep their business open. It's ridiculous. You know, when did the Republican Party abandon the market economy, market strategy, market idea of supply and demand? You're becoming like communists, right? You're paying the business to keep the store businesses open. It's nothing but socialism. That's socialism. Capitalism is letting the market dictate, right? Market dictates the business. That's capitalism, right? Supply and demand, right? During COVID-19 America, if the demand for restaurants go down, in a capitalist economy, it is the smart thing to let these businesses go bankrupt, right? Because there isn't a demand. Now, what PPP does is it keeps the businesses that should go bankrupt open through funding. So US government is wasting billions of dollars through this PPP program, paying businesses that doesn't have demand open when they should be shut down, right? So the Republican Party is messing around with the capitalist system like they're socialists. You gotta stop acting like socialists, right? You gotta let the market determine the business. You're paying small businesses lots of money to keep the business open when there's no demand. What's the point of that? That's what's destroying American economy. It's an artificial buoying, inflating of businesses. In short term, it may look good, but in the long term, you'll destroy the nation. Because I believe in capitalism as the best system. And in capitalism, market determines, supply and demand determines the market. So you have fads that come in, fads that go out, right? And when fads come in, there's a demand for what people want. So businesses open around the demand and supply what the demand wants. Do you see what I'm saying? Businesses that don't have demand close down. And the business owners of these businesses that no longer have demand will sell their business and reinvent themselves to provide things that are needed. Right? So capitalism works because we let the market determine business. What PPP does is a socialist agenda. It pays the business owners money to keep paying their employees just to keep the businesses open. It's absolutely ridiculous because that's socialism. That's not capitalism, that's socialism, right? You're keeping businesses open for the sake of keeping them open. That's what socialists do. And we know it didn't work in Russia, former USSR countries. Why do you think it will work in America? Well, you think socialism failed in USSR, but it's going to succeed in America? No, no way, Jose. Socialism will fail in America as well. This PPP is a stupid program that is nothing but socialism. State-sponsored socialism, that's what it is. We have to end the PPP program, transition into emergency mode, stimulus checks for every citizen. Because if you give stimulus checks to your citizens, some of them will use that money to pay rent, but others will use that money to reinvent their businesses that are failing because there's no demand. And that's going to determine our economic strength. You have to let businesses that don't have demand fail. That's the only way capitalism works. If you artificially pay businesses to stay open when there's no demand, country will collapse. Country will collapse. It's like guaranteed. Because capitalism's fundamental principle is supply and demand. If the demand is down because of whatever the factor, now in 2020 America, it's COVID-19. So demand for restaurants are down, for example. You gotta let the restaurants fail. You have to let them fail. And then those restaurant owners have to reinvent their businesses to provide where there's a demand, whether it's toilet paper, whether it's N95 masks, whether, because government cannot make all the N95 masks everywhere in every state. So restaurant owners can reinvent themselves to make N95 masks and sell them. There's a demand for N95 masks in America. We're right now buying them from China because US government is not allowing supply and demand to dictate the market. If we did not have a PPP program and we allowed the businesses that were going under to let go under, they would have reinvented themselves because they had no choice. And we would have had thousands of companies emerging that creates masks. And that's how our country would become independent of China. But that did not happen because we had a PPP program artificially keeping these businesses without demand open. This is how a country fails. PPP program will cause America to fail as a nation because it's a socialist program. You see what I'm saying? You deviate from a capitalist market, you're not going to succeed. You're not going to survive as a nation. You will not survive. Your economic system will not survive. And that's what's the problem with PPP program. End it. End the PPP program. We need to let the market determine business because we have demand. So before COVID-19, our demand was like, oh yeah, restaurant. We had demands that were pre-COVID demands. After COVID entered America, demands have changed, right? What are the demands we have now? Let me just list them for you. Number one, we have remote learning. In every state, there are schools with remote learning who need resources for remote learning, right? Whether it's services, products, right? Now that we have COVID-19, more people are eating at home, making food at home, or they could get food that's delivered. So restaurant businesses, which used to have indoor dining, will have to transition into delivery. But if you give them PPP money, they're not going to transition, right? They don't have an incentive to. So they're just receiving PPP check from the government, and they're not shifting their business to the COVID-19 reality. How is that going to help America? You're just paying them to stay afloat. It's like a socialist system. It's shocking that some Republican governors are like, oh, PPP, like they're like championing a socialist program. It's ridiculous. Why are you championing socialist program? I don't understand. As you know, I'm run as independent for U.S. Congress of Virginia's 8th District in 2020. I'm currently running as an independent, but I may run as a Republican for the primaries in 2022. It's probably primaries are generally in March. But the Republican Party has become socialist. It's a problem. PPP program is a socialist program. And it's destroying capitalism in America that's going to make our country survive. That's going to help our country survive. You destroy the capitalist impulses in America, you destroy the nation's economy. You have to let the market determine businesses. That's the only way our nation is going to survive, because our nation's demands have shifted in COVID-19 America. And you're artificially paying businesses to stay open when there is no longer demand for that business. How is that good for America? How is that good for America? You need to force the business to shift to provide the supply for the new demands. You know what's going on now? So there was demand for indoor seating restaurants before COVID. Now there isn't a demand. US government is paying these businesses to stay open, and they have no customers. And they're talking about prolonging this stupid socialist program. Now, Americans may not need indoor dining anymore, but they need other things. Because they have remote learning, they need things to support remote learning in their home, in the school setting, right? They need better services in terms of delivery services. You know how Amazon has very good delivery, but every school which engages in remote learning has to need delivery services to get their study materials from their school to the students. So restaurant businesses can close and become delivery businesses at the local level for, let's say, Arlington County Public Schools, to provide delivery services for materials to support remote learning, for example. There's money in that sector, remote learning sector, that could be diverted to new businesses that are more delivery oriented to provide delivery, like same-day delivery services of learning materials to students, right? So a company that used to be a restaurant can transition into delivery service and can win a contract with Arlington Public Schools or certain schools in Arlington Public Schools to bring learning materials, because there are physical learning materials that students may need. That's not electronic. So that they have same-day service. Now, this is not going to happen in COVID-19 America with PPP program, because businesses will not adapt to survive. Do you see why we're destroying America with socialist PPP program? We're destroying America because businesses are not adapting to meet the demand. So what's happening in America? Everything we need in COVID-19 America, like masks, we're buying from China. How is that good for America? So we have trillions of dollars going from America to China because America's restaurants could easily transition into making N95 masks at the local level. In Arlington County, restaurants in Arlington County can ship themselves to make like masks, N95 masks, but they have no incentive to, because they're getting PPP money. So the socialist program called PPP is destroying America right now, because we need masks, but we're buying them from China because we're paying every business to stay in the same sector, not to transition to meet the demand of the American people. Do you see what I'm saying? Everything that's been happening since the beginning of pandemic, like the PPP program, which is a socialist program, is contributing to the destruction of America as a nation. Because we have demands, and in a laissez-faire capitalist system, these demands will be met by suppliers who evolved to provide the supply to meet the demand. And that's how Weber's capitalist system was supposed to work. And it worked well in America. But now the government is meddling with this PPP program and destroying the capitalist market. You know, this PPP program is destroying the capitalist market. We're becoming a socialist market. Because the foundation ABC of a capitalist system is you create the supply to meet the demand. You see what I'm saying? Our country is headed toward failure economically because you're artificially keeping businesses alive that should go belly up. There is no guarantee COVID-19 is going to go away. And I'm saying 100% of vaccines will not work because COVID is mutating. Different strains come into existence. You're never going to have a normal life in America unless you flatten the curve completely. And that's now impossible. It's too late. So given that we're going to have next 10 years of COVID-19, don't you think it's better to let the market dictate which businesses stay open? How are we going to survive as a nation for the next 10 years of COVID-19? What are you going to pay PPP to small businesses and medium businesses and large businesses for the next 10 years? It's absolutely ridiculous. We should get rid of the PPP program. Let businesses that are going to go bankrupt, let them go bankrupt. If we pay every citizen like $2,000 stimulus checks, we will keep our country floating until all the businesses evolve to meet the demand. We need to become independent of China. That's never going to happen if we're constantly buying stuff from China. And we're constantly buying stuff from China because of the PPP program that's preventing our small businesses from evolving to meet the demand in our country. Do you see what I'm saying? PPP is a socialist program that's destroying America. We need to end it now. You see why I'm running for US Congress? These congressmen in both parties, Republican, Democrat, they don't know what they're doing. These Republicans, they're touting PPP, a socialist program, like they've achieved something. How is making America a socialist country better? We need to keep market economy, capitalist system alive. Now, if we give stimulus checks to citizens, we're giving people with demand money to purchase the supply. Do you see what I'm saying? We're not destroying the capitalist system here. Each citizen with their $2,000 stimulus check can buy whatever they want, right? They have demands that has shifted in COVID-19 America. They need masks. Now, they don't want to die, so they're going to buy masks. Now, if there's a supply of masks being produced by restaurant, that has changed to become a mask producer, that new business that's evolved will get the money that China will get. Do you see what I'm saying? So paying each citizen stimulus check and allowing them to use that money to do whatever they want, buy food, pay rent, purchase masks, we're keeping the demand alive. And we're giving purchase power to the demand, right? Which provides an incentive for small businesses to evolve, transform into suppliers who will supply to the demand that is able to pay for the supply. So we're keeping capitalist system alive until it can stabilize in COVID-19 America, which is forever, for the next 10 years. PPP is what's destroying America's economy. It's preventing businesses from transforming to meet the demand. So we're constantly buying stuff from China because our demand has shifted, but our companies, our small businesses have not shifted to meet the demand because of PPP. PPP is the worst idea in 2020 America. That's the most destructive to our American economy, PPP program. We need to focus on providing purchasing power to the demand, and that we need to allow the businesses to shift in a capitalist system of supply and demand. That's the only way we're going to survive this economically. Republican Party is doing everything wrong. Democratic Party is doing everything wrong. This is why you need Leonardo da Vinci of 21st century, Heerak, Christian Kim to come and become a US congressman to save this country from itself. It's self-destructing right now. Do you see what I'm saying? I'm explaining these in language you can understand. So I'm sure you're understanding what I'm saying. See, how come nobody told you this? Because they're not Leonardo da Vinci of 21st century. I am. I'm Heerak Christian Kim. I am the Leonardo da Vinci of 21st century. So I can think these things at a very 3D dimensional levels where not a single Republican senator, a single Republican House of Representative member, a single Democratic House of Representative member, single Democratic senator can think about these because they're not Leonardo da Vinci's. They're politicians. That's all there are. They're limited. This is why you need to vote for me if you want to save the country. It's too bad you didn't vote for me to be a congressman right now. You know, these things, your country's going to self-destructing because you don't have the leaders you need to save it. That could be the story of America. You needed me in Congress to save America. I do what God wants me to do. If God wants me to, save people in a hospital, I'm happy to do that. But you needed me in U.S. Congress to save you and this nation. And it's too bad for you and for United States of America that I'm not being sworn into Congress in January. It's a big tragedy for the United States of America because they have no clue. Republican senators, congressmen, Democrat senators, and Democratic senators, the Democratic House of Representatives, they have no clue how to save this nation. Do you see what I'm saying? Do you understand what I'm saying, right? You understand exactly what I'm explaining to you. You cannot fix problems for like 1 week or 2 weeks. You got to look at the long picture, the long run, at a systems level. What are the systemic adaptations we need to survive as a country? Current senators, current House of Representative members in both parties cannot think in a systemic level to paradigm shift into COVID-19 model. They're not able to do that. And unfortunately, the economists in America, they're idiots. They're not able to do that. I mean, they're not Leonardo da Vinci. They're experts in their little microeconomics or macroeconomics, and COVID-19 is like shocking them. They don't know how to adapt. This is why Leonardo da Vinci is a national treasure. You know what I mean? Where would America be if Heerak Christian Kim did not give you ideas to survive COVID-19? How many Nobel Prize winning economists have explained how to adapt in COVID-19 America to you the way I have? Do you see what I'm saying? So all you economists out there in America, you should be watching this show every day for some ideas. Because obviously you're not coming up with them. Yeah, so let's go to the second article. I guess, we have a few more things to read there. 35 doctors and 1 nurse who worked directly with COVID-19 patients signed onto a November 24th letter, so it was a while ago, that they sent to Governor Lamont, and copied to Acting Public Health Commissioner Dr. Deidre Gifford. The rapid increase in admissions and severity of illness that we are seeing here in the ICU. This was going on in November 24th. Can you imagine what it is like a month later? It's far worse. The rapid increase in admissions and severity of illness that we are seeing here in the ICU and the wards is incredibly concerning, the letter reads. That was 1 month ago. It's like old news. As I said, expect 3 million Americans to die by June minimum. I'm expecting 30 million Americans to die by June. I don't want any Americans to die, but the idiots are not doing what they should be to keep Americans alive. You see what I'm saying? I said, close all the schools down. You should listen to me. You know how many months I said close all the schools down and just do 100% remote learning? Why didn't you listen to me? Our country will be in a completely different place now if you had you listened to me. I'm like the lone voice in the wilderness, paving the way for your salvation, and you're not listening. You're just heading toward your destruction. You see what I'm saying? All you have to do is go remote learning in every public school. We would have like so much fewer cases right now. Everything is hindsight 2020. But I said this before it happened. That's what makes me the Leonardo da Vinci of 21st century. Now, number 3 article, 100 new COVID-19 deaths. 2,973 additional cases reported in Massachusetts. Massachusetts had 3-digit death now, 100 deaths. So health officials reported an additional 100 COVID-19 deaths on Sunday in 24 hours. The largest number of new deaths to appear on daily reports is May. The grim report brings the state total to 11,852 deaths since the start of the pandemic. The report also added 2,973 additional confirmed cases to the state's total, which is now 338,704. United States of America is very lucky that I am the citizen of United States of America. I'm running for US Congress to save you and your family and the country from COVID-19. Unfortunately, Virginia's 8th District residents, well, because of COVID-19, there are a lot of situations that then come together. But it's unfortunate for Virginia's 8th District and the nation that I didn't get elected as Virginia's 8th District US Congressman. It's tragic. Because obviously right now, US Congress does not have a clue. It's headed toward destruction at the speed of light. And that's happening at the systemic level. PPP is the biggest problem, in my opinion. Because it's a socialist program, preventing capitalist impulses from working properly. It's dangerous. That's why I've never praised PPP ever. It's a socialist impulse. Why should I praise a socialist impulse that destroys capitalism? There's no reason to praise it. I think it's the worst idea. Whoever thought about it is an idiot. It's destroying capitalist system, which is what our system is. Yeah, but you see why you need to watch this show every day, especially if you're an expert economist, because your expertise has become obsolete. In COVID-19 America, your economics expertise has become obsolete. You need the ideas and creativity and the insights of a Leonardo da Vinci to help redirect you in COVID-19 America to become useful as economists again, that will actually contribute to America's betterment and survival in COVID-19. Because right now, economists are not cutting it. Expert economists are not cutting it in their field. This is what happens. Whenever a tragedy happens, or a shocking thing happens, or an emergency happens, people who think in the traditional models, they're convergent thinkers. They can't survive. That's where Leonardo da Vinci, like myself, a divergent thinker, comes in, look at the situation, analyzes it from multifaceted dimensions using interdisciplinary expertise, because I'm a Renaissance man. I have many expertise. So I could look at it from many different angles, use many different methodologies, synthesize it, reinvent methodologies to fit today's situation. That's why you need me. I'm like the most important national treasure in the United States of America right now. But you're lucky I'm here, and I created this show to give you these ideas. Because right now, America is headed toward complete and utter destruction. The fact that politicians in both parties, Democrats and Republicans, think that vaccines will work, that itself is superstition. It's not science. COVID-19 is mutating. Science says when there are mutations, vaccines will no longer work. So why aren't you trusting the science? Why do you think we get different flu vaccine every year? Because of the virus mutations. Do you get the same vaccine every year? No. You have to adjust the vaccine to meet the mutation. That's why we get a flu shot every year, because flu mutates. But it's just seasonal, right? It comes in a season, disappears, reappears with a mutation. because they mutated during the 3 months of flu season. COVID-19 is 365 days a year. It's 12 months. It mutates constantly. So why do you think the vaccine will work? Doesn't even make sense. When last year's flu vaccine doesn't work this year, why do you think COVID-19 vaccine will work after all the mutations of COVID? That's not science. You see what I'm saying? I'm saying let's use science. We have these principles in science. Why do you think the vaccines will work with all these mutations in COVID? What in the science tells you that it will work? Science says mutating viruses make vaccines obsolete. Why don't you follow the science? I don't understand why you're being so superstitious. Well, I mean, I understand why politicians are being so superstitious. They don't know the science. But Dr. Fauci, you gotta be honest with people. With mutations, vaccines become obsolete. Why are you like not telling them the truth about science? We need to be honest and truthful about the principles of science here, you know? False hope is a very dangerous thing. People get vaccinated and they think like they can go back to normal life when the vaccine doesn't work at all because of all the mutations. They don't wear a mask, they're going to get COVID and die. This is why truth is important. You don't want people to be completely vulnerable after getting a vaccine and thinking that they're protected. It's like giving them a Superman cape and saying, now you can fly. And the person jumps off the building and dies. How is that helpful for saving America? You see what I'm saying? Let's be honest about the science here. COVID-19 is mutated. We have mutated strains that have been identified. There are many strains that have not been identified. How can the vaccine work against the mutated strains when the science says they don't? I'm telling you, COVID-19 is 365 days a year virus, which is constantly mutating, right? It's not seasonal like the flu, influenza A and influenza B. We cannot keep up with its mutations. The scientists cannot keep up with the mutations. Even if you develop a vaccine that works, science cannot keep up with the fast pace of mutations to adapt the vaccine to meet the mutations. Why can't we be honest about that here? You see what I'm saying? Scientists have to be honest about this because you don't want to give people a cape and say you can fly when they can't. Yeah. Anyway, you know, I love America, and that's why I'm running for U.S. Congress to save it from people who are trying to make this country into a socialist nation with like programs like PPP. It's tragic what's happening in America right now. We're spending trillions of dollars on Chinese manufactured goods because of programs like PPP that's preventing American businesses to adapt and evolve to meet the demand. It's tragic. It's absolutely tragic what's happening in America. Republican Party should have been focused on giving every American the purchasing power to be able to pay for the demand. There is a demand, but in order to buy stuff, you need money. But they focus in the wrong area for last, 7 months, 8 months. That's the tragedy right now of America. People are focusing on the wrong areas. That's going to ultimately result in our nation's economic collapse. This is why you need a Moses, a leader to guide you, right? Why do you think I'm running for U.S. Congress? It's not like I want to be a politician, right? Because God is guiding me in this direction because there are a lot of Christians out there who are praying to God to save our nation. So in a sense, I'm an answer to your prayers, you know? Well, I can be an answer to your prayers. You got to vote for me. I have to go to Congress to actually do stuff. But while I'm not in Congress, I'm going to try to help them, give them guidance, but, that's why this show is important, if they listen to my guidance and recommendation, things could go well. Like if all the 50 states closed down public schools and 100% remote learning, we could have been this much closer to flying the curve. But we're light years far away from flying the curve because all the schools open. Like not all the schools, but a lot of schools open. Yeah, it's tragedy that's happening right now. Because this is going to be a 365 year 365 days a year virus, and none of the vaccines will work. They won't work because the mutations are far faster than the science right now. Because these are living organisms constantly mutating. We're not looking at a virus that's like fixed in time. They're mutating constantly. They're organic. It's a living world. And our science is not advanced enough to keep up with this virus and its mutations. That's the problem. But anyway, I am the Leonardo da Vinci of 21st century. And as you can see from this program, you can see why I am the Leonardo da Vinci of 21st century. You can see why all the experts around the world want me to come and present my paper in their conference. Because I am the Leonardo da Vinci of 21st century. Whether it's in Jewish studies, whether it's in New Testament, they need my ideas. Do you see why they need my ideas? Because I'm a divergent thinker. The most difficult thing is to come with creative ideas that adapt to particular circumstances as they arise. The highest level of knowledge is creativity. I have it. 99% of experts don't. Like they could spit back information they studied, but they can't come up with anything new. Because creativity is the highest level of knowledge. Yeah, but I'm the Leonardo da Vinci of 21st century, and you're lucky I have created this show, because this show is open to experts and non-experts alike. And those of you who follow my guidance can see a windfall in terms of there are already businesses that have followed my guidance that become millionaire businesses. Information is power. It's a new currency of 21st century. Obviously, you could throw the information away. The Bible has a saying. It says, "Do not throw pearls to pigs." There's a saying in the Proverbs. It says, "Do not throw pearls to pigs," because pigs don't appreciate it. They don't know the value of the pearl. But anyway, yeah, I'll let you mute on that a little bit. This is a daily show, so tune in tomorrow for very valuable information and expert insight that you will not find anywhere in the world. Because there's only one Leonardo da Vinci of 21st century, that's me. There's no one else. So, it's a burden, but it's a burden I carry with conscientiousness. I know what I am, and I use my power for good to provide service for humanity, right? Yeah, but obviously, it's in your interest to protect me and make sure I don't get attacked. You need my information, There are people who are like evil villains, I don't want to call them evil villains, but there are people who, for whatever reason, they don't want you to have this information that is necessary for your survival, your children's survival, and obviously you need to neutralize them. Because you need this information, whether you're an expert of economics, whether you're a Republican Party politician or Democratic politician, if you love America, you need this information that I, as a divergent thinker, creative thinker can provide, only I can provide. You need this information to save the nation. So obviously, you're going to neutralize anybody who was trying to divert, this information from being transmitted to you. You see what I'm saying? I mean, it's in our national. This is a national security issue, really. We're talking about it, whether our nation survives as a nation or not. It's a national security issue. So yeah, I am a national treasure. Come on, let's be honest here. You've been watching this show. You know I am the national. So I am the national treasure. That's why you gotta guard me with all your life. You need to take a bullet for me because you need me to save this nation. You know what I'm saying? I know who I am. It's important to know yourself. You need to know who you are. You need to know your own worth and value, and you need to act accordingly. Right? That's very important. You shouldn't undervalue yourself. You should not overvalue yourself. You need to understand exactly what your value is, right? And that's why that philosopher said, "Know thyself." Right? It's important to be metacognitive and understand oneself. In Israel, they say, "Rock Rega, Rock Rega." It's like, wait a minute, Rock Rega, Rock Rega. It's like they form a like little, they put all the fingers to the thumb and they go, Rock Rega. You do it like this, Rock Rega. In America, it looks like you may be giving them the middle finger, but it's not. In Italy, it's like, if you go like this, it's like Rock Rega. But make sure they're Israeli Jews, because that works with Israeli Jews, but it may not work with like, other ethnic groups, right? So it's better to say Rock Rega as you do this, so that they know it's not a curse thing, Rock Rega means wait a minute, Rock Rega. Yeah, it's a very, very popular thing in Israel. It's a very Israeli thing to do. You could do it to your like roommates. Rock Rega, Rock Rega. And anyway, yeah. So COVID-19, America, barring any miracle from God, is forever. This is person-to-person transmission. People who are infected keep it alive. And at the 200,000 per day infection, it's going to be kept alive throughout next several years, next decade, right? This is permanent condition. Barring a miracle from God. The vaccine is not the miracle because vaccines are already outdated. All the vaccines are already outdated because the virus has mutated. So yeah, they're all obsolete. None of them will work. You'll see what I mean, as death rates climb and people got vaccinated, get COVID and die, you'll see what I'm saying is absolutely accurate. That's all coming, don't rush yourself. We have 6 months to go, we have 180 days to go. So, sit back and enjoy the ride. I don't know if enjoy is the right thing to say, but yeah, I mean, it's COVID-19 America. What do you expect, right? That we must have data-driven decisions. Data-driven decisions, very important. Data-driven decisions. So, I hope that you will be well and that your family will be well too. And I will look forward to seeing you tomorrow. Bye.